This is Varsha Singh, your host for TVAsia Telugu channel Healthline. It's really nice to see you every time watching our show and learning more about how to take care of your health using multiple ways. We have used modern medicine, we have interviewed many physicians who have advised you, and in this special series, we are focusing on integrative health, functional medicine, holistic medicine, alternatives such as homeopathy, Ayurveda, Reiki, yoga, massage therapy, and many more those modalities that can add value and quality to your life. In past few episodes, we have focused specifically on the mode of medicine which is known as homeopathy. Homeopathy has its own science, similia similibus curantur, which means like cures like. Homeopathy is being practiced all over the world and it has its own success stories. Today, we have another special practitioner with us who will share her experience as a homeopath. And she will also share her expertise in women's health. Daxa Vaishnav is a homeopath from India. She has not only practiced homeopathy, but she has taught many students. And you will hear more about it from her own words. Daxa Vaishnav is practitioner for 36 years. And in these 36 years, she has practiced in India as well as now in United States of America. She has set up her practice in Bay Area of California, where she is practicing since 2012. She has focused on women's health, especially in the field of infertility and polycystic ovarian disease. Now, what does it mean and how she practices? Let's hear what Daxa Vaishnav has to share with us. So first, let me welcome Daxa Vaishnav to Healthline on TVAsia Telugu channel. Welcome, Dr. Daksha, as I have always known you.
Thank you, Varsha.
So this is our Healthline show where we are going to talk about your journey, your practice, and your experience with homeopathy and the patients and all those women that you have treated. So let's begin the first part of this session where I'm going to ask you, because you are the best person who can tell us about all your experiences, your practice, and your journey. Can you tell us what you do?
So, Varsha, it's been a very fulfilling journey. As a young adult of 21, I had graduated from the Homeopathic College in Mumbai. And looking back at 36 years of a journey, it was a very fulfilling journey. So I've been actively involved with homeopathy and the women's issue since 1985. That's the year when I passed from the Homeopathic College as a graduate. And I had always interested in learning the women's issue. And that's how when I passed my graduation and I knew what I wanted to do, and I had decided I'm going to sit with a gynecologist and learn a lot about what is a practical gynecology and a clinical gynecology. So I was a professor and the head of the Department of Obstetric and Gynec at the Homeopathic Medical College. And since then, I've always had a passion to learn more about the women's issue. I was also a faculty at the practitioner and the doctoral program of homeopathy in American Medical College of Homeopathy in Phoenix. And also, I'm a visiting faculty at the Caduceus Institute of Classical Homeopathy in Santa Cruz. I've also taught at the medical students and the MD doctors in Austria. And I was also a subject matter expert and advisor to the Central Council of Research in Homeopathy of Government of India. and have contributed to their publications as an author and an editor.
Thank you so much, Dr. Daxa Vaishnav. It seems like since 1985, and it seems like that was a different world back then. But the homeopathic practice that you are describing and your journey and participating as faculty and teaching students at these different countries, it's not just India. You mentioned Austria. So why? And I know that homeopathy addresses the person as a whole, and it is effective in children as well as adult, any age, no race bar, no age bar. However, you decided that you wanted to focus on women's issues and you wanted to develop expertise in that. So how did you develop this expertise, and what kind of journey, what kind of path did you take? How did you become a homeopath who is a woman specialist?
So tell you the background story in 1985-86, that is almost 35 years back. So immediately after passing my graduation, there was an opening of a lecturer post in the homeopathic college. So I jumped for that lecturer post, and soon there was an opening in obstetric and gynec department. And that was the year, if I remember correctly, it was the year 1988 or 89. And the hospital had just started with incorporation of all the different specialists. So the gynecology department had started, the surgery department had started, the orthopedic department had started, the ENT department had started. So basically, from 25 bedded hospital, the hospital was expanding to 100 bedded hospital at that time. So I was given an opportunity as a lecturer in obstetric and gynec, and I immediately took it up. And I remember me and some of the senior doctors, of course, now senior, and they were junior at that time. We were all there. We were so enthusiastic to develop this department and this hospital. So from 25 bedded hospital, we started the 100 bedded hospital. And slowly from OPD strength of 4 or 5 patients to 1992, 95, at that point of time, we were seeing almost 60 to 70 patients in the OPD, in the outpatient department. And from 100 bedded hospital, there was a time when the obstetric and gynec patients were almost 50% of the patients. And I still very clearly and vividly remember that we had almost 100 patients delivering in a month. So it's such a big turnover of the patients were there. So much of learning experience was there. And I learned a lot. And one more thing, Varshak, I can tell you is there was a very unique thing about our hospital in India, where a homeopath and a allopath were sitting together. So this was very unique. So I have learned a lot sitting with a gynecologist about the clinical skills. And because the hospital had just started developing, I used to assist them in surgeries. And they taught me how to do surgeries, how to assist in surgeries. And I had even started doing a minor surgical procedures. So that really helped me in learning and diagnosing patients at a very young age. So I remember that there was a time when I had to prove to them that homeopathy works. And it was such a beautiful thing that we would sit together, we would look at the patient holistically, we would decide what is best for the patient, whether the only allopathic line of treatment or only surgical line of treatment, or we could do both homeopathy as well as surgery or as a allopathy. So I had a lot of enthusiasm of learning through the patient and giving them the results with homeopathy. That was a challenge. I took it up as a challenge. And that's how my journey into treating patients, getting experience, and giving them results. That was a really a fulfilling experience for me.
So it sounds like when you started, and going back to almost 1988, it seems like a long time ago. Mm-hmm. That the collaboration had already started when you actually incorporated the modern medicine, the surgical therapeutic medicine, and as well as homeopathy as an adjuvant. Right. And now you are, after 36 years, it's a big number, 36 years of practicing and expertise in women's issue. Now you have your own practice in Bay Area of California, where you continue to see mostly women patients.
Mm-hmm.
So let's talk about what are those issues that you most commonly see in your practice. I know that you have a specialty in infertility management as well as polycystic ovarian disease management.
Mm-hmm.
But what are the most common issues that you see in your practice?
See, Varsha, let me start with a very, very nice definition as a male gynecologist would tell me. It was the definition given by my senior gynecologist at that time. And I still remember it very, very well. And he would say a woman is a biped who has two legs, who micturates once a day. That means who urinates once a day. Of course, is going to the extreme. Who defecates once a week. That means who has the motions, the bowel motions only once a week. Who menstruates once a month and who parturates. That means the one who delivers every year. This was a definition of woman. So definitely, in a today's scenario, it is politically absolutely incorrect definition. Even I used to get bugged. Oh, how can he say like that? But of course, it's coming from a male gynecologist. So, and looking at it and now going back and thinking through it, physiologically, this definition was very, very true. Female have tendency to hold the urine, and Varsha, you know how this India was in early 90s and 1930s and 1960s, 1980s. Hardly there is availability of the public restrooms in India. So women, being a woman, they could control the urination for a day. They could defecate once a day, once a week was a little extreme, but the hormonal issues and the special progesterone hormone, again a very important female hormone, can give rise to relaxation of the intestines. And that's why females get constipation in the premenstrual phase, or they get constipated during pregnancy. So that's also physiologically very, very true. Menstruation once a month is definitely a norm. And earlier in 1900s or even before that, it was very natural for a woman to deliver every child every year or every 2 years. If you look back, the grandparents of our age, they had almost 10 siblings. So the women were very fertile and they were delivering every year. And that was a physiological function of female. Now when we put a stop to it, when we try to suppress this function of menstruation every month by giving hormones, although many females are on birth control pills at such a young age. Nowadays, the hormonal issues have risen since the puberty going up to the menopause and even after menopause, with patient opting for HRT. So we are constantly suppressing the natural hormonal rhythm in the female. And when the parturition is postponed, people are choosing not to have children. This is, of course, that's personal choice, but then you are going against the nature's law. Nature has destined a female to have children. So when you don't choose to have children, or when you don't have children due to some medical conditions, then the chances of a fibroid uterus, that's a growth of the uterus, increases. The chances of endometriosis is increasing nowadays. So all these female issues are increasing because we are curtailing the natural female tendencies, the natural female flow.
That's a great point. What you are saying is that there is a certain way a female body is physiologically created to perform its function.
Yes.
And now that women are using their personal rights,
Yes.
that this is my body and this is my right. I can choose to have a child. I can choose to wait for some time because I'm focusing on my career, or I want to focus on some more important thing, or maybe I want to be more ready when I'm going to have a child. So this is just kind of a barrier or a halt in the natural flow of the progression of life. And that's where you see that the issues or the problems or any ailments are coming because we are not going through the natural flow of life, right? I just wanted to kind of reiterate what you were saying to our viewers.
Right. So unlike a man, a woman goes through a lot of hormonal changes, starting from puberty, going to the menopause, and even through the menopause and after the menopause. And not only that, even through the menstrual cycle, every phase in a menstrual cycle, she's in a different emotional state. And especially this gets heightened after the ovulation and before the periods. So a woman is constantly going through the emotional turmoil. During pregnancy, again, her female hormones are so high, you can have emotional symptoms. Postpartum depression, again a hormonal issue. Perimenopausal depression, again a hormonal issue. So women or female goes through a lot of hormonal issues which men does not go through it. And there's a lot of support a woman needs in those trying times. And that's why, as a female, as a homeopath, I can really empathize with the women who really need medical help. And I think homeopathy is the best answer for so many conditions, even the thyroid issues from puberty, pregnancy, postpartum, again at menopause. So all these are the interlinked hormonal issues which can be worked on very well with homeopathic medications.
Okay, thank you so much for clarifying and explaining all those hormones that you see throughout their lifespan, from puberty to fertile age to menopause. So I know that you definitely have a lot of young women coming to you and seeking your advice. But I see that your more focus is on the fertile age of the women, and you are focusing mostly on management of infertility.
Mm-hmm.
So here, when you look at the modern medicine approach, there are many infertility clinics, and patients usually seek the modern, which is a proven evidence-based practice, and they seek advice of their OBGYN gynecologist. So how homeopathic management that you provide is different? And question would be, are you giving homeopathic management as an adjunct, as a supportive, or exclusive? So you may have patients who are also under the management of the OBGYN, because infertility is a very significant issue. They really want to take care of and have a child in their life. And then some patients may come directly to you. So there are two scenarios. So I would really like you to emphasize on homeopathic only or both.
Right. See, Varsha, it's a well-known fact that the desire for children by the normal woman is stronger than self-interest in beauty and figure, even stronger than the claims of a career. She can put aside her career when she is ready for the children, and she can again take it up after the children are born. I've seen so many of the women, they do that, they give up the career for that. And it's also a well-known fact that the desire for children by the normal woman is stronger than self-interest, and infertility can cause personal unhappiness and ill health, and having children cements a threatened breakdown of a marriage. So it's a very, very satisfying and unenviable position to be in, helping infertile persons or couples conceive. So what I saw, as I just talking to, as I was talking to you about my journey in 1990, 92, 95, we had a gynecological department, but we didn't have an infertility separate department. And I used to see a lot of women coming with infertility issues, and there was so much of pressure on that poor woman to conceive. And remember, imagine the era in 1990 in India. The onus of having children was only on the female. The male was never considered as an important part in having a children.
Mm-hmm.
So a female was going through tremendous emotional turmoil, and that really made me being so empathetic to those female who were suffering through the stigma of barrenness. It was like a stigma to them. So I started working on these issues, and then started helping them with helping them conceive with natural homeopathic medicines. But I have seen there are two types of patient. One type of patient where they have been with you. I've had many girls when they are unmarried, they come to me for polycystic ovarian disease, where their cycles are very irregular, and they are willing to try homeopathy once they get married and when they are ready for the conception. And I've seen them conceive very beautifully within few months of trying out with homeopathy, and with few months of waiting for the conception, they carry through pregnancy very well. And there are second type of patient who have tried everything in allopathic line of treatment. They've tried IVF, they've tried intrauterine insemination, and it seems to be an unexplained case of infertility. Everything is fine. Maybe the husband is also, his count is normal, she is fine, but there is unexplained infertility. So these are the two types of patient they come to me for homeopathic line of treatment. To just give you an idea of one recent case which came to me for infertility. She had a very difficult case. She's been trying since last 7 years of marriage. She had a fibroid uterus. She had a septum in the uterus. The uterus was divided by a septum, and she also had an endometriotic cyst. And she got this operated. Her fibroid was removed, her septum was removed, and in spite of that, she had two more abortions, which were natural abortions. She conceived naturally, but in 8 weeks or 10 weeks she aborted. After that, she tried for IUF. Three failed IUF, and then she was so frustrated. All this treatment was going on in India, and one of her neighbor happened to be my old patient. So that patient referred her that she had already moved to US. So why don't you try homeopathic medicines? So with this history, she had two more conditions which were not in favor of conceiving naturally. One was her anti-Mullerian hormones were very low, and the anti-Mullerian hormone is a significant. It signifies your fertility age. That means if the anti-Mullerian hormone is very low, that means this patient has a very poor egg quality, and they are the patients who usually go for premature menopause. So her AMH was very low. If I correctly remember, it was just zero point 0.1. And one more hormone was very high, that was the prolactin, which is again a hormone related to this lot of stress. It was almost 37. And this patient was frustrated. She came to me saying, Doctor, anyway, she started treatment in October or November, if I very correctly remember. And she said, in March, I'm going back to India because I have my 3 embryos were frozen in India. And I'm to go again and going to start IVF treatment there. So if you have any treatment options, please let me know. And I remember starting her treatment in October or November of 2019. And by January or February, her urine pregnancy test came positive. And she delivered a normal, healthy baby, and in October or November. So this was a beautiful case. It was a complicated case. It was a challenging case. But the way she went through the pregnancy, and she's so grateful, doctor, you really took care of me, care of during pregnancy. I didn't have to go through IVF. And that's a very traumatic experience for some of the females. So that was one recent case that is delivered, and she is in New Jersey right now. And another case, I remember when I came to US in 2012, very similar case. She had polycystic ovarian disease, and she had a low anti-Mullerian hormone. She had so frustrated, she was so depressed. Again, the same, because people in India, one of my colleague who is a homeopath to her, referred her to me that Dr. Daksha is in the US, why don't you contact her? So she also started treatment with me. She also was going to go back to India for IVF treatment, and she also conceived, and that was in 2012. And now that girl is almost 8 or 9 years old. So every time I see that girl, I feel so happy. And as her AMH was very low, just recently I had a call from her. Doctor, I think I'm going into premature menopause. She was 34 when she delivered, and now she's 44, almost 43, 44. And because of her low AMH, she's going into premature menopause. But these are very, very fulfilling cases. And sometimes in the history, you get peculiar sensation, peculiar feeling, and that give you a idea about which remedy works best for your patient. So
So,
another patient that I had seen in my OPD, that was long back in the 1990s or 92. A young girl who just recently got married, and she was 2 years had already passed after a marriage. And in her history, when I went through the history, she said, I asked her, what was your saddest moment in your life? And she said, the doctor, I was in love with a person, and we were going steady for a long time, but I had some heart issue. And the moment that her boyfriend realized that she had a heart issue, she broke off the relationship. And this female was so dejected, so depressed. She got remarried, and after 2 or 3 years of trying to conceive, she couldn't conceive. But there was a blockage in her case. That feeling of betrayal or feeling of so much of grief was still remaining with her. And that time the drug Netromure, which is a very good drug for long effects of grief, has really worked in this patient. So these are some of the cases still coming into my mind. There are a lot of cases. These are the few cases which really gives me a satisfaction that yes, homeopathic is the safest and easiest and less costly treatment and a fulfilling treatment for so many patients who are really desiring of pregnancy.
so when I'm listening to you, same as many homeopaths have suggested in previous interviews, that the choice of medicine is primarily based on how you ask questions which are not particularly focused on their symptoms or what is affecting their gynecological symptomology,
Mhm.
but you focus more on what you like, how you feel, what makes it worse, and you actually incorporate all those things that creates that individual personality.
Mhm.
And you in your experience, you see that this individual approach, holistic approach,
Mhm.
for treating person as
Mhm.
whole and as a different person,
Mhm.
has enabled you to treat them effectively.
Right.
So, more switching our gears from infertility to polycystic ovarian disease,
Mhm.
which is again considered as a difficult disease to be treated in mainstream medicine. So, can you share some of your cases and experiences with PCOS?
So let me tell you what is PCOS first. So the PCOS is a short form of polycystic ovarian syndrome, and it is thought to be a lifetime of female hormonal imbalance. And why is it so? Because the maturing eggs, they fail to be expelled from the ovary, and that creates an ovary filled with multiple small immature follicles, and they are usually at the periphery. So if you see ultrasound of a patient with polycystic ovarian disease, you can see the beaded appearance. It's like a beaded appearance on the neck, how the beads are there. The same appearance you can see on the ovaries. So this condition not only causes infrequent ovulation, but it causes a lot of other hormonal issues. And these are the hormonal issues no female wants to go through it. There are girls who come with severe cystic acne or acne in general. A girl who comes with excessive hair growth on the face or excessive hair growth on the body. A person can come with high insulin and a diabetic like conditions usually, or when this is not treated in a longer run, one of the complication of polycystic ovarian disease is diabetes later on in life. Or it can bring about infertility because they are not ovulating. It can bring about amenorrhea where they cannot have menstruation for months together. If they don't have menstruation for months together, there's no chances of them ovulating. And if they don't ovulate regularly, there's more chances of this patient going in for infertility. And even if they conceive, they have more chances of developing repeated abortions or recurrent abortions. Now, what is so pressing about polycystic ovarian disease in South Asians is they have a higher insulin concentration and the lower insulin sensitivity, especially in South Asians. And that's why they are more prone for diabetes later in life. And I've seen a number of cases increasing by multifold. Now, if I tell you the reason, in 1985, it was not even an entity. Polycystic ovarian disease was not even known. There was just a mention of one Stinn-Leventhal syndrome in a textbook of gynecology in 1935, which showed a picture very similar to polycystic ovarian disease. So nowadays, why is it rising? The cases of PCOS, why it is rising, there are no answers. Either there's a genetic background to it, or environmental factors, or a use of plastic. That's also another important thing. People in India still uses a lot of plastic bottles, and they can really mess up with your hormones. Or the stress of modern living. These are the various things that are the postulations.
Mm-hmm. It's really difficult to understand why we have so many new age diseases, new diagnoses, and sometimes the conditions that we never heard about. And I recall, of course, in 1990s and 1992s, very few cases of even carcinomas.
Right.
But this is now a modern age. There are more causative factors. And as you mentioned, that it can be environmental, use of plastic, and there are many other environmental factors that can lead to changes in the cellular structure. So that's a postulation, as you said. There is no proven theory why we have so much incidences of polycystic ovarian disease. So when you approach management, or when the patients come to you, do you have anything different that you do, or you have the same that is called as fundamental approach towards every patient?
So basically, yes, when I'm dealing with a patient with a constitutional homeopathic treatment, I go through the patient as a whole and go through all the different causative factors in her life. And what is seen, as one of the other known homeopath also has seen, that the role of women in the society has changed over the time. Earlier, in early 1900s till 1950, 1960, most of the women, especially in India, were homemakers. They were not going out, they were not hand in hand with the men going through that stressful life situation of men, right? So women, though they have changed emotionally, their body has not changed over the time. So they are independent. They want to be ambitious. They want to postpone the childbearing. They want to adopt a man's role in the society. But the body is not ready for that yet. So that is the reason we don't know. So when I started treating more and more cases of PCOD, I realized that there is some stressful period in most of the females that I was treating. Either that stressful period was during the pubertal age or during the adolescence. Or the parents were comparing the girls to their brothers. Oh, the brother he's into medicine. You should also strive to go for medicine. Oh, so and so's girl is now a topper in the university. Even you should be a topper in the university. So there is a indirect pressure. Either it is self-inflicted or it is pressure from the parents or the pressure from the society that a girl also has to excel like the others in the society. So maybe that causes a switch in the hormonal balance in those women. And I've seen that stress, and when I can pinpoint that stress and can find out what exactly was the stress, that really helps me in treating this patient better.
That's a great point, that you are finding a common ground, that possibly stress, whether it is physical, mental, if it is peer pressure or certain expectations that they have to meet. So it brings me to another question. When you treat all these patients and when you identify that they had some degree of stress, Do you incorporate any kind of interdisciplinary practice, such as do you refer them out for any counseling? Do you work with other modes of practitioners? And if you have a team of people, like, yes, I'm treating the woman's issues, but this patient can also use your help, and talk to the patient and encourage them to seek some help with the psychological counselor and understand how they can limit or reduce current stress in their life.
That's true. That's very, very true, Varsha. So when I deal with teenagers, and especially in the US, of course, that's now the true, even it's globally, even in India. Uh, so there are some kids who just succumb to the pressure. And there are some kids who just go through it without any effect on their body or mind. So when they are struggling, whether, and this is more seen in young girls, whether eating disorders, body image issues, or a peer pressure, or to be absolutely rebellious in the family. And these are the changes that you see suddenly. A young girl of 8 and 9, and you see her after 5 years, there's a drastic change in her. This pubertal changes can be very devastating to certain families, to the patient herself and to the family, to the parents also. They suddenly see a sudden change in the daughter. And at this time, definitely homeopathy works. But when you realize that the things are going in a different direction, or the things are deteriorating, it's affecting person's psyche, person's relationship, person's way of thinking in life, then definitely the counseling is always advisable. And I've seen, as the basic psychology, or you read any basic psychological textbook, there are 6 basic feelings: love, sexual feeling, joy, anger, sadness, and fear. These are the 6 basic feelings in everybody's life. And any of this feeling is blocked or it is suppressed, that leads to physiological changes, and this physiological changes later on becomes the physical issues, and that can affect your mind, your psyche, your chemicals in the brain. It can affect your hormones, because hypothalamus is the center of the hormones, and hypothalamus, that is the grandfather, really takes care of all these emotional issues in the body. You are not happy, your hypothalamus knows. You are in extreme stress, your hypothalamus knows. You are in a danger situation, your hypothalamus knows. If you're hungry and starving yourself, your hypothalamus knows. It can give rise to suppression of menses. Nowadays, I'm seeing a lot of girls with body image issues, with eating disorders, and they have menstrual problems. They don't menstruate regularly. So it's all a part and parcel of a human being. And of course, they will need help in psychology and counseling. That will definitely help.
Yeah. I just wanted to explain the viewers when you were saying hypothalamus. So hypothalamus is actually part of our brain, which is right in the center of the brain, and it harbors the master endocrine gland, which is also called pituitary. So as Dr.Daxa Vaishnav said, if we are angry, our hypothalamus knows, and then it tells the pituitary, and pituitary releases adrenaline or epinephrine, which is kind of makes our heart go faster. So it's how our body is regulated through our endocrine system. So in PCOS, what would you recommend? What should this girl, or what should the woman do if they are suffering from polycystic ovarian disease?
So apart from giving homeopathic constitutional treatment, I ask those patients to regulate their body weight. But it is very true that the female hormones, the estrogen and the progesterone, are stored in the fat cells of the body. So if your fat content in the body goes down drastically, as in a patient of eating disorder, anorexia nervosa, then they stop menstruating because there's no storage of estrogen and progesterone in their body. At the same time, if you are obese, if you are overweight, then also there is a disturbance of hormones, because then too much of estrogen and progesterone is stored in the body. So remember, there has to be a balance in life. Too much of any good thing is not good. Too much of hormone is also not good, and too less of a hormone is also not good. So it has to be balanced. So regular exercises, sleeping habits, that is also going to help her with the insulin levels and the glucose levels. So whether she does aerobic, she does a weight training or a swimming. So what I would recommend is at least 5 to 6 days of 35 to 40 minutes of aerobic or a walking exercise, incorporated with 2 or 3 days of weight training. That's what even the WHO recommends for a healthy lifestyle. So these lifestyle modifications are really, really important in reducing the bad effects of PCOS later in life.
Great. So here again, I'm pointing out that it's not just the homeopathic medication. It's not a magic. It's not a miracle. The patient has to be partnered with the provider or the practitioner and take a pledge that, yes, I'm going to be better and I'm going to do everything in my own limits or in my own capabilities so that I can get better. I think every one of us has that power, and we need someone to continue to motivate us, like our practitioner who continues to advise us. So, Dr. Vaishnav, I just want to go one step further and ask you that definitely you don't have only female patients who are coming to you for treatment of infertility. I'm sure there are some men who are your patients too. So, what's your approach when you diagnose and when you assist them to find some relief in their symptoms?
So, Varsha, it's a very good question. So, many of the times the male partner is sort of not looked into, you always, and most of the cases of infertility basically land up with obstetric and gynec. And their field is to look after the female. So, the male partner is usually not looked into. So, I always, whenever a couple comes to me for infertility treatment, I first ask for a partner's semen analysis. And I've seen that with today's lifestyle, wearing tight clothes or working in a hot environment, it really affects the sperm motility and the count. And I've seen that even in patients who are in a very highly stressful condition, especially patients who are in a IT sector. Especially, I've seen a lot of patients coming from Bangalore or Hyderabad. They are in such a stressful condition. They work 16 hours a day. No leisure time on hand, and so much of, and if both the partners are in IT industry, they've had it. The wife is also working 18 hours and the husband is also working for 18 hours. They don't have any personal life, and that really affects their sperm quality and quantity. And apart from that, if they are living a very unhealthy lifestyle, too much of alcohol or a smoking or recreational drug, this all becomes a part and parcel of releasing your mental stress. So that all affects the sperm count. And we have many drugs in homeopathy which can help with a varicocele. That's a medical term used when the varicose veins of the spermatic cord are engorged or enlarged, and the temperature increases of the spermatic region, and that also hampers the spermatogenesis. So I've seen many young males with poor motility, with poor count. They are also helped very well with homeopathy. And I've recently had a patient, of course, both a husband and wife, both are working in bank. Husband has so much of stress of performing only during the time of ovulation that he cannot perform. So that's called a psychical impotency. And I've treated this patient with homeopathic remedies, which is indicated for psychical impotency, and that has worked very well for that couple. So these are the certain issues where homeopathy can work. And if the male patient has some reservations or they cannot openly talk to me as a female doctor, I would always take help of my husband, who is also homeopath, and we both work together in treating husband and wife together.
Thank you for sharing all your experiences and treatment of infertility, not only for the female patients, but also for your male patients, and going over the polycystic ovarian disease. The idea of this episode about homeopathy is to give our viewers an idea that there are some options, and they definitely need to discuss with their own primary OBGYN, because it's always important to collaborate and understand that homeopathy is an option to improve your health. There is a possibility, and it can assist anyone. If Dr. Daksha has managed a lot more cases in her 36 years of practice. So the last question would be, if someone wants to reach out to you, if they have any question, any concern, how and which is the best way?
Thank you, Varsha, for inviting me today and talking to your viewers about homeopathy in infertility and PCOS. And I can be contacted for the US patients. They can contact me on my phone, that is 408-201-3093. Or some of my Indian patients or patients all over the world, they can contact me by my email, and they can write the email to my email address of office@drvaishnav.com.
Thank you so much. Just exploring all the possibilities of treating a human body. We know that human body is mysterious, and we should never be saying that there is nothing that can be done. There are options: natural, holistic, integrative, and there is a possibility of integrating all the modalities, and a person can feel better. So thank you again, Dr. Daksha Vaishnav, for sharing your experience, your tips, and discussing the cases that you have treated. Thank you. On behalf of Healthline, your host Varsha Singh, I'm saying bye for now. I hope you enjoyed today's episode, and I will expect you to watch it again next time when I will have another special guest with me. Bye now.